National Poison Prevention Week. Hi, everyone. I'm Jennifer Tran, a PA in the Pediatric Emergency Department at Children's National Hospital. I also serve as a medical provider and a public health specialist for the Children's National Occupational Health COVID-19 Response Team, and I'm a proud member of Safe Kids DC, a nonprofit organization working to help families and communities keep kids safe from injuries. Did you know that medications are the leading cause of poisoning in children? Each year, 500,000 parents call poison control because their child got into a medication they shouldn't have or took more of the medication than was meant to be prescribed. More children get brought to the emergency department every day for medication poisoning than car crashes. Toddlers are by far the most at risk for accidental poisonings because they've just started to master moving and are curious about everything. And because they're so little, only 1 or 2 pills can cause serious harm. So, what can you do as a parent or caregiver to keep your child safe from accidental medication poisoning? Here are the top 5 tips for medication safety. Number 1, always put medicines and vitamins away after every use. Never leave them on the counter. And be sure to talk to visitors or anyone else living in the home about medication safety. More and more grandparents are living with us, helping with childcare, and up to 20% of pediatric poisonings involve the grandparent's medication. Do not be tempted to keep the medicines handy in a purse, backpack, or briefcase, or in an unlocked cabinet or drawer where it's possible for a child to reach. Number 2, don't be fooled into thinking over-the-counter medicines are safer than prescriptions. Both can cause serious harm to kids. Most poisoning in kids come from the medicines you can buy without a prescription, like pain medications and anti-allergy medications. And a lot of those medicines look like candy, and kids can't tell the difference. This over-the-counter pain-relieving pill sure does look a lot like a piece of chocolate candy. And this nighttime cold and flu medicine can look a lot like juice to a kid, but it contains 10% alcohol. You have to be very careful. Number 3, always read and follow label instructions when giving medicines to children. Watch out for the concentrations on liquid medicines as they can change with a prescription. For example, your last prescription, you might have been giving 10 milliliters of medication. But if the concentration changes with the new prescription, you might only have to give 5 milliliters of the same medication. Know the right dose, how to measure the right amount, and the right tool to use for the measurement. And that takes me to number 4. Only use the dosing device that comes with the medication. Never use a household utensil, such as a teaspoon or a tablespoon, to measure medications. The size of those tools can vary a lot, and that can be the difference between a safe dose and a dangerous dose. And number 5, be sure you know if the medication packaging is child-resistant versus child-proof. Contrary to popular belief, child-resistant packaging does not mean that it is child-proof. Child-resistant just means that the packaging meets a standard that requires it to be significantly difficult for children under 5 years of age to open within a reasonable time, and not difficult for adults to use properly. That means children might have a harder time opening the packaging, but that does not mean that they won't be able to open them. Medicines that come in a child-resistant packaging account for about half of all accidental poisonings from medicines in children. If you are worried that your child has gotten into a medication they shouldn't have or received too much of that medicine, don't panic. Check your child first. If they seem to be seriously sick, like they've passed out, can't be awakened, had a seizure, or have a hard time breathing, definitely call 911. Otherwise, you can call poison control at 1-800-222-1222. Again, that's 1-800-222-1222. Even as medical providers, poison control is often our first call when a patient presents for concerns of medication poisoning. So save this phone number in your phone and post it in your home. Poison control will want to know what your child took and how much, so have the pill bottles ready if you have them. They can tell you if you need to go to the hospital or if you can stay at home. If poison control tells you to go to the hospital, try to remember to bring the bottle of medication with you. You can also download the Poison Control app on your smartphone, which can help you look up pills and guide you through an exposure. Then, if you want to get rid of medications that are either old or you don't use anymore, your local police department or pharmacy may be offering a safe take-back program, so get in touch with them first. If this isn't an option, you can still get rid of medications at home. Mix the medication with something that people and pets are unlikely to eat, like coffee grounds or kitty litter. Put that mixture in a container that can be sealed and then throw it into the trash. It is very uncommon that medications need to be flushed down the toilet to be safely disposed, but the DEA does have a list of those medications available on their website. That's it for now. Thanks so much for listening and watching this episode of Bear Bites, and hopefully these tips will help keep you and your family safe. If you have follow-up questions, feel free to leave them in the comments or send us an email to safekidsdc@safekids.org. Stay safe.